hypoxia in respiratory patients. Assessing respiratory patients. The ability to carry out and document a full respiratory assessment is an advanced skill for nurses working in the respiratory field involving initial assessments, palpation, percussion, auscultation, and further investigations. This is not expected of you as a nurse who is acting at the level of a newly registered nurse. Tests for respiratory patients would normally include chest x-rays, spirometry, peak flow, ABGNBG, arterial blood gases or venous blood gases, and ECG. These tests would likely have already been done before admission to the ward in A&E or would have been planned to be completed as soon as possible on the ward. A prompt initial assessment allows immediate evaluation of severity of illness and the appropriate treatment measures to be put in place at that time. This may affect the urgency with which these tests are performed or whether they need doing at all. Your role. During the physical assessment, you should decide if there are any immediate interventions to be made and whether escalation to the medical team should be made straight away. You do not need to know or refer to which test needs to be done. Just refer to whether a doctor should review the patient's current situation and if it is an immediate review that is required. It must be determined if their condition may even require a higher acuity department or ward or may need continuous monitoring. But again, this is something to escalate to the nurse in charge and doctor. Escalation is determined by their new score you get from taking the patient's OBS. Additional recommendations may be made by the doctor, such as increased frequency of OBS with a particular focus on one or two areas of the observations, such as oxygen saturation levels and respiratory rate, but this will not happen during the OSCE itself. The nurse in the assessment should look for evidence of increased respiratory effort or marked accessory muscle use. This may be demonstrated by the actor's shoulders being raised on every inspiration. If they are tachypneic, a high respiratory rate, the rate, rhythm, and pattern of breathing should be assessed, and whether it appears shallow or noisy should all be noted. Tachypnea is one of the first signs of patient deterioration. An attempt to prevent further decline is essential, so medical intervention is necessary. When responding to questions, the nurse should note if the patient has decreased speech tolerance and is unable to finish a full sentence. It should be clear if the patient appears to have pallor or cyanosis. The actor could wear makeup when playing that patient. A set of observations will reveal if they are experiencing hypoxia and the relevance of this if their oxygen saturations are still low despite having oxygen therapy. Hypoxia could mean an altered level of consciousness, and although we do not expect OSCE actors to show this, they may show other signs such as confusion, agitation, aggression, or tiredness. If they are struggling with speech, this may be assessed through how they are managing to answer questions, whether they are using full sentences, phrases, or just words. Patients in severe respiratory distress may be unable to speak in full sentences or may need to catch their breath between sentences. Hypoxia can often affect exercise tolerance and how far that person can walk at that time. It should be compared to how far they can walk on a normal day. Their body position should be noted, and if they are slumped forward, as this will further restrict full air entry to the lungs. Encouraging them to sit up will help increase their lung capacity and ability to expand their lungs. Note if breathing is noisy, labored, shallow, or very deep. Also note if they are clutching their chest or throat.